With Joseph Kalua. He's been a surgical tech for 1.5 years, and he's working in the ENT pod currently. Joseph, what does a surgical tech mean, or being a surgical tech mean to you?
For me, being a surgical tech, it's like a stepping stone for me to a better career, because I really aspire to be an OR nurse. So everybody told me like you should start being a surgical tech first, see if you like it, and I did like it, and I was happy that I got into the program and actually worked in Memorial.
Okay, so this is really a sort of a launch pad for you to a RN career,
yes.
OR nurse.
Correct, that's correct.
Okay, well, congratulations. We're glad you like it.
Thank you.
Thank you for your professionalism and everything you do. We really appreciate it.
Thank you.
And happy surgical tech week.
All right.
All right, thank you. And we're here with Betsy Quezada. Did I say it right?
Yes, you did.
We're here with Betsy, and she's from a very special pod. She's from PDCV. Hi, welcome.
There.
I want to say happy surgical tech week.
Thank you.
All right, so Betsy,
Yes.
where did you go to surgical tech school, and how long have you been a surgical tech?
I went to Houston Community College and I've been a scrub tech for 3 years.
Three long years.
3 long years, yes.
Well, at Hermann, 3 years is like
At Hermann.
30 years.
Yes.
Right. So you learn a lot in that amount of
I
time.
have, yes.
Okay. So what are some of your favorite cases to do? Like within
My
the pod?
favorite cases, PDCB, open heart surgery, and besides that, PD neuro, working with Dr. Dean.
Oh, okay. Those are very important cases. I mean,
Yes.
I'm sure the mothers and the parents of those babies would appreciate it.
Yes.
Yeah. All the parents do too. And we want to tell you happy surgical tech.
Thank you.
Okay, welcome back. We're here with Amana Recio. And Amana, I want to say happy surgical tech week, first of all.
Thank you.
And we want to ask you a couple questions. First of all, how long have you been a surgical tech and where did you train?
Almost 8 years, and it was at Shepherd Air Force Base.
Oh, okay.
The military Air Force.
So you were trained in the military?
Yes.
Okay, did you serve time in a combat zone or
Yes.
where?
Iraq.
Iraq.
Or Iraq.
Iraq. What base were you stationed?
Balad Air Base. It's like
Balad.
15 miles north of Baghdad.
Okay. And what was that experience like, being in a different country, serving, you're not serving the U.S., being in a combat zone?
It was crazy.
Crazy.
It was a little scary sometimes.
Okay. Well, we appreciate your service. And to the country, first of all, let me just say that. It's very important that you're recognized for that. But what are some interesting things that have happened to you while you've been a surgical tech? Like, what funny experiences have you had?
Funny experiences. Well, should I talk about this on camera?
Yes.
Okay. There was baby powder. There was baby powder on a patient's bottom, and we were flipping the patient over, and one of the doctor's faces was right by the patient's bottom. As we flipped, the patient expelled gas and powder went in his face.
Oh, the old projectile powder trick. Yeah, you got to watch out for that.
That was the funniest, I think.
Okay. Well, we just want to say thank you for doing the interview and allowing us to get to know you. Thank you for serving your country. We really appreciate that.
You're welcome.
And we really appreciate your professionalism and all that you do here. Thank you very much.
Thank you.
All right.
Bye-bye.
My name is Crystal Scott, and I'm a surgical technologist here at Memorial Hermann Hospital. I've been a surgical tech for almost 3 years now. It's something that I really enjoy doing. It's something that I've always wanted to do. What made me want to do it is I would sit at home and watch the Discovery Channel all the time, different surgeries and different procedures, and I would always wonder, who's that person passing the instruments and like kind of in the middle of the action but kind of standing back a little bit. And when I found out what it was, I went to school, and now here I am. I would suggest this field to anybody who likes blood and gore, I guess I can say. It's fun though, it's a fun career. I love it.
We're here with Charles Williams from the orthopedic department, and we got 2 questions for Charles. Charles, welcome. Happy surgical tech week, by the way.
Thank you.
All right. So, how long have you been a surgical tech?
Almost 8 years now.
8 years?
Yeah.
8 long years. Okay. So, how long have you worked at Hermann? I heard you've been here longer than that.
Yeah, I've been in Herman 25 years, October the 7th.
25 years.
25 years.
This man need a break. Okay, 25, 25 years. And so, what are some of your favorite type of cases you like to do in orthopedics?
Well, you can give me a total joint case any day. I'm doing a lot of foot and ankle cases.
Okay.
Any type of trauma case, do me fine.
Okay, and I hear that you have worked on, actually Charles has worked on some of Houston's finest athletes. We're not going to say any names, but how did those cases go? And did you find it kind of, very rewarding?
Well, those cases went fine. They haven't been bringbacks, as far as I know.
Okay.
Case by case, you treat every patient the same. I didn't look at it as a big deal, but
I did.
case by case.
Okay. Roberto Masad from the orthopedic department. And first of all, I want to tell you happy Surgical Tech Week, Roberto.
And back at you, and happy Surgical Tech for all the techs here at Memorial Hermann Hospital.
So we're going to have a few questions. How long have you been a surgical tech?
I've been a surgical tech going on 24 years now.
Okay. Where did you go to tech school?
I went to surgical tech school. I started out in Austin, Texas. I took my prerequisites there. Then I went to Temple College and actually did the surgical technology program there from 1987 to 1988. And I was hired there at Scott and White Memorial Hospital in Temple, and I was there up until 2006
Okay.
when I came here.
Okay. And what are some of the funniest or craziest experiences you had in the operating room?
Just working with these guys in orthopedics, orthopedic trauma, the residents, the fellows, a lot of the surgical techs are a blast. And a lot of the surgeons, they got a sense of humor, believe it or not. They're a bunch of great guys, and I just, I look forward to coming here every day.
Well, that's great. That's great. Well, on behalf of the Surgical Tech Leadership Council, we want to say thank you for what you do. Thank you for your professionalism, and we really appreciate it.
Thank you very much, Derek. And by the way, hook 'em horns.
Tamika Burrs, she's a surgical tech. She works in pediatrics. And so, first of all, I want to say thank you for doing the interview. She's a little bit nervous, but it's okay. But we want to know, how long have you been a surgical tech, and where did you go to school?
I went to school at Houston Community College, and I finished in 2006.
2006?
Yes.
All right. What made you want to become a surgical tech?
I was working here as unit secretary, and I was trying to find something interesting to do, something challenging. So I was just going on the internet, and I found about surgical tech. So I just checked into it and enrolled,
And here you are.
and here I am.
So do you have a funny story or something funny that's happened to you while you've been working in the operating room?
Yes, I do. My very first day, I was scrubbed, and my preceptor asked if I wanted to sit down. I was like, yeah, sure. So I'm like this, and I'm scrubbed. Can I stand up?
Yeah.
So I'm scrubbed, and I'm like this, and it was one of the pink stools, and the pink stools, they don't really sit still. You have to kind of hold it, but I didn't know that. So I'm like this, and when I sit down, I hit the floor. Bam. So I'm still like this on the floor. I'm terrible. And it was embarrassing, but after that, I learned to put my foot on the pink stools.
Well, that is crazy. There you go, folks. There you have it. Sterile all the way to the floor. Anyway, well, happy Surgical Tech Week. Thank you for doing the interview.
Thank you, Derek.
And we really appreciate it.
Thank you.
We really appreciate what you do.
Thank
All
you.
right? All right. Wallace, welcome, Danielle. Happy Surgical Tech Week.
Thanks.
Okay. So how long have you been a tech, and where did you go to school?
I've been a tech for almost 11 years.
11 years?
I was a Sanderson
11
College.
years? San Jacinto? Okay. And where's that?
Pasadena.
Pasadena. Okay. And what made you want to become a surgical tech? What brought you to the field? People want to know.
I don't know. I went to nursing school. That did not agree with me. When I was in nursing school, I did a little OR rotation, and that's where I was a surgical tech.
So that was your first exposure to the OR. Okay. So do you enjoy what part of it again?
I'm in general surgery, urology, GYN, robotics.
Okay. What's been like one of the most interesting or funny experiences you've had in the OR that you can talk about here?
I have one, but I don't really think I can say it on the.
Oh, okay. Well, in that case, we'll leave it to the imagination. Well, we just want to say thank you for doing the interview. I know this is not your normal situation, but happy Surgical Tech Week. We appreciate what you do. Thank you for the professionalism, and keep it up.
Okay,
All right,
thanks.
thanks. Surgical Tech.
The excitement of the job, helping people with, like as far as the patients go, learning new things,
Mm-hmm.
meeting new people,
Okay.
things of that sort. And surgery is very innovative. So just constantly, it's always something new that you can learn, always
Mm-hmm.
something happening in surgery.
So I'm sure you work in the trauma pod now, is that correct?
Yes, I do. I'm in trauma transplant.
Okay, so you guys help really, save a lot of lives. I'm sure.
Yes, we do.
Well, we appreciate what you do. We appreciate your professionalism and your dedication, and we just want to say thank you.
Thank you.
All right.
Mr. Cedra, K-Tom Bishop. I've been a tech for about 15 years. I was trained in Lawrence, Louisiana, Delgado Community College, where I was trained at Charity. When I first went into the program, I really didn't know what a surgical technologist was, but I went into it. My very first case was a trauma, which really caught me by surprise. But a patient came in with a knife in, they poured betadine. What I love about surgical tech is the adrenaline that keeps me going. It's like a box of chocolates. You just never know what's going to happen. And it's like a fast pace, and that's what I love, and that what drew me to surgical technology. So in that institute, I just love doing it, and coming here to Texas Medical Center, I loved it even more so because it gave me the adrenaline, it gave me more ambitions, and gave me more tools to learn. Because as I've been a surgical tech 15 years ago, things is constantly changing, and that's what I love. Because it's flexible, you're always learning something new, and it just keeps you going, and it's just a wonderful profession to be in. You want that adrenaline, you want to help, you have that passion. I have the passion to help others, and that's what I love about surgical technology. It's a never-ending story, and I just love it.
Pretty sure I've been a tech for, it'll be 10 years in November. I was trained U.S. Army 91 Delta Branch, Fort Sam Houston. This was my first gig. My initial reason for going into the surgical technologies field was to actually get medical terminology because I was a paralegal before that, and I was going to use it to get the qualifications necessary to become a legal medical specialist for various insurance companies and whatnot. I liked it so much that I decided that I would actually stay in the surgical technologies field. It has really been one of the best moves I ever made, becoming a surgical technologist. It was here at Memorial Hermann where I cut my teeth, and I developed a rapport with, the surgeons that we work with, residents, ancillary personnel. It became like a big family-oriented thing here. And I also learned various different surgical procedures. Just the shift that I chose to work. I chose to work 3 to 11, and level 1 trauma center, 3 to 11 means you do whatever comes through the door. And my first year here, I scrubbed in any and all procedures, anywhere from a simple abdominal washout to a 360 spinal fusion, and all points in between. It was one of, working here on that specific shift, working here on that particular shift just really helped me develop into the surgical technologies that I've become. are so many good people and good technologists that I've actually come in contact with. Some have gone on to do other things, such as, you know, become nurses. Some have gone on to, you know, do, you know, first assist and whatnot. And me, I like what I do, and it's very fulfilling to, you know that, you know, you're helping to give someone a chance, you know, for their bodies to heal. You know, that's the best thing about it. It's not, I don't look at what we do as, you know, God. Like, I look at what we do is give these people a chance, you know, so God can help them. You know, it's pretty much like I said, it's done. You know, monetarily speaking, I've been able to do way more in the last 10 years than I ever did before. You know, I'm able to, you know, take care of my family, my wife, my son. You know, and I'm proud of the fact that I actually paid for our wedding. You know, it was something that, you know, I helped my wife finish her bachelor, her undergraduate degree, and get into graduate school. You know, all on this salary, on doing this job. So, you know, I'm in the process of buying a house. So, you know, this is one of the best, like I said, the best things that have happened to me. And, you know, I kind of fell into it trying to go in another direction, but ended up liking what I did so much that it's been 10 years. So, that's all I'm saying. Happy surgical technologies.
I've used the universal precautions.
Yes, get 7.
Quesadilla. You ready?
Yeah.
You didn't give me the usual signal that you.
Okay.
Yeah.
Go.
Hello and welcome back to STLC Television. We are here with Tamara Williams, and I'm sorry. Great thing, we include everybody, and everyone gets made fun of.
This is my time to shine.
I know, it was supposed to be my day, but I had a bad day.
You look great. Thank you.
Did you get to wear makeup today? Okay, Amada Recio.
You ready?
Yeah, they're gonna laugh at this. Welcome back. We are here with Amada Recio.
And the way it works is if I'm working,
My shit, get my shit together.
Tech Week.
Surgical Tech Week.
All the surgical scrub techs out there. Y'all are so good, so wonderful, and I'm so happy to have you here.
And I just want to say that all the surgical techs here at the hospital and all over the nation that's watching this tape, happy Surgical Tech Week. We all deserve it. We all work really hard at what we do every day. It's a commitment. It's more than just a job. And I just want to say happy Surgical Tech Week to everybody because we really deserve it. We deserve our